In this module, we will look at some of the features of PowerPoint and how to use them effectively in creating slides. In this slide, notice the clash of the colors between the red, blue, and purple, and the lack of contrast that makes the letters difficult to read. Similarly, in this slide, red and green clash, and the lack of contrast between yellow and light green make the words difficult to read, especially from the back of the room. This is a more basic color combination with white background, black letters, and colored bullets. But the most classic combination, which reduces glare, uses a dark blue background with some shading, white letters, a colored title, and different colored bullets. In this slide, notice the difference between the readability of the two fonts. On the left-hand side, we have Times New Roman, which is used for manuscripts and books and looks very nice. But in projecting slides in a room, this font called Arial is easier to read. The reason is that Arial is what's called a sans serif font, and as you can see, it's easier to read than Times New Roman or this type, which is called Courier or italicized. What does sans serif mean? Serifs are the little feet that come off the ends of the letters that make them look very nice in a manuscript. And sans serif means without serifs, so that Arial font contains no serifs. Another way to set off certain letters in a slide is to use bold or shadow, although you wouldn't want to use that for an entire slide, but only to set off certain words. In this slide, again, we have Arial on the right, and on the left side we have italics, which are more difficult to read, as you can see. So they should only be used to emphasize certain words. This slide has Arial on the left, and by contrast you can see that the all caps lettering on the right-hand side is harder to read. It takes longer, and the other problem with it is that in this day of email and texting, using all caps actually means that you're yelling. So do not yell your slides. Font sizes should be big enough to see from the back of the room. Here are some examples. This is 14 point. 24 point is usually the smallest that you can get away with using in a large room or an auditorium. This is what 32 point looks like, and this is 40. Anything larger than 40 may be impractical to use because you get so few words on a slide. So in general, use the largest font that you can get away with. In this slide, you can see that the presenter is making certain points about Mallory Weiss tears of the esophagus. And the slide is not too crowded. There are only 4 bullet points, and they make the point that Mallory Weiss tears account for 10% of cases of upper GI bleeding, that there is retching found in only 30% of the cases, and so on. The problem with this slide is that it looks as though the presenter has put every word that they're going to say on the slide, so that you can imagine them simply reading this slide, and if the audience reads it along with them, there's really no point in having the presenter there, and the audience will quickly lose interest. It's better, therefore, to use a slide like this, where you put just a little bit of information, but say more than you write on the slide. You can make the same points, you can say the same words that you said on the last slide, but just show the bare outline of what you're saying. 10% of cases of upper GI bleeding, there is a history of retching found in about 30% of cases, and so on. This will keep your audience's attention more, and it will also allow you to expand on the points even spontaneously if you want to do that in your presentation. Here's another example of someone who was trying to answer the question, which sort of IV fluid should be given to a person who is volume depleted? And they were comparing free water, or 5% dextrose in water, with normal saline as a therapeutic fluid. In doing this, again, I think that they put every word that they were going to say on the slides, and they also made slightly different points under each heading, which is a little confusing for the audience. It involves a lot of reading and looking at a lot of numbers and trying to compare them. So in making a slide like this, you're probably better off to do some quick comparisons and speak the audience through what you want them to see. So you could take the information on this slide and make a table, starting with the question that you're asking, which IV fluid is better for volume repletion? Then show the table comparing the two types of fluid, the fluid compartments in which they distribute, and the percent of the original fluid that actually ends up in the intravascular space, which is where you want it to be. After making your point, you can then show the audience which fluid is better. Another way to do this, if you want to get colorful and to use pictures, is to use some PowerPoint pictures and animation and to ask again the question, what is the best way to correct volume depletion? You can then show a slide of the different body fluid compartments, intracellular fluid, extracellular, plasma space, and interstitial fluid. You then show that if you give a liter of D5 water, it distributes into all the body compartments, meaning that only 83 mLs actually ends up in the plasma or intravascular space. In the second example, giving a liter of normal saline, it only goes into the extracellular fluid, and 250 mLs, or 25% of what you give, ends up in the vascular space. So this is the same way to make the points off of the previous table and just use a little animation and pictures to do so. That's the end of this module, and in the next module we will look at some more advanced features of PowerPoint, including animation.